Welcome everybody to our first informational series titled Defeating ALS Together. For those of you that I don't know, my name is Tammy Galt and I'm the Director for Community Outreach in Central California of the Golden West Chapter. I've been with the chapter for 5 years. First and foremost, thank you everybody for being with us tonight. We'll be sharing a lot of information and exciting information about how we, the Golden West Chapter of the ALS Association, are advancing our mission priorities. Make sure to write down any questions that you have throughout the entire presentation, because at the end, we will be opening up for Q&A. Before we jump in, I want to start the evening off with a quick poll. This poll is going to pop up in your screen right now. And you're going to take just a few seconds to select all that apply to you here.
All right, we're making progress. We're almost 3/4 of the way there. We'll give everyone a few more seconds to give their answer here. All right, I think we'll stop the polling there and we'll share the results. So thanks, Tay. I know Tay's behind the scenes and Katie's here as well, running the slides for everybody. Hi, everybody. My name's Cliff Whitlock. I'm the director for Team Challenge ALS. I've been with the chapter for 5 years. Team Challenge ALS is our chapter's endurance program, rides, runs, volleyball tournaments, swims, triathlons, you name it in the sporting world. We're trying to jump into that. And I know from my experience for both Tammy and I, we ask this question a lot and receive lots of different answers. So it's really useful for us to see what everybody is interested in learning about tonight. So most of you want to learn more about research and clinical trials and chapter services for people living with ALS and loved ones. We're definitely going to touch on those two, but we're going to go over everything. So tonight, you're going to hear what our mission is, how it all works together, and we can stop sharing. I think you did. We're going to cover how it all works together, advocacy, care services, research. You're going to hear from some incredible guest speakers for each of our pillars of our mission. You're going to learn how we actually fund that mission, how we make that mission work, how we're defeating ALS together. And then you'll learn how to get involved if you would like to do more with our ALS community. So again, if you have questions, I'm going to actually be the person you chat those questions to. So you'll just send me a direct message. And at the end, I'll be able to sort through those and ask those in an orderly fashion. We'll also give you the opportunity to, if you'd like to verbalize your question, you can raise your hand with a reaction button at the bottom. So hold on to those questions at the end. We hope we'll answer all of them here in the presentation. Again, thank you for being here. So let's jump right in. So our mission, as you can see in front of you, working together over the last few decades, we built a community committed to fund scientific discovery, to provide compassionate care and support, to inspire others to action, and to empower people affected by ALS to live their lives to the fullest. And in other words, again, this is like a three-pronged mission approach: care services, advocacy, and research. And I full-heartedly believe that we need to do all three at the same time. There are plenty of other organizations and groups who focus just on one, but we do it all at the same time, and we have to. And you'll see on this next slide how it all works together. You can't have clinical trials without people to actually run those clinical trials on. You can't have advocacy without people to share their stories and push elected officials to actually invest in research. You can't also provide funding for research without raising money for it. And that's part of what we do here. So it all really connects together, and we hope that you come away from tonight understanding how it is intertwined and why it is really important that this is our mission and this is why we do what we do. And you're going to learn how we're making an impact in those three pillars. So I'm going to jump right in, talk about the first pillar, which is care services. And you'll see on your screen here, these are just a few of the impacts that we've been able to make over the last year or so. We are the largest chapter of the ALS Association. The Golden West chapter serves 31 counties in California and the entire state of Hawaii. And that's 1,800 people living with ALS, but that receive free care services from us. But it's not just those people, it's their loved ones. So their spouses, their kids, their grandparents, their grandkids, their cousins, their caregivers. It's the whole network. So this is thousands of people that we support every year who are diagnosed with ALS, who are living with ALS, and are struggling with the disease. We also work with 27 multidisciplinary ALS clinic partners. This also includes, I think, around 8 certified treatment centers of excellence, which we help provide funding for. And they check all the boxes with multidisciplinary care and participate in clinical trials. Since the pandemic began, the big silver lining that we've seen is that we've been able to reach people in underserved areas or people who weren't able to actually come to in-person support groups. So now we're offering more than 30 monthly online support groups for people living with ALS, for caregivers, for a whole host of different topics that are covered, from wheelchairs to clinical trials. It really runs the gamut, and hopefully maybe some of you have attended those. And then equipment loans, we have a pretty robust program in our service area. So if you need a walker or a communication device, I know a lot of you are interested in learning about chapter services. Please reach out to us and we'll do what we can to get you that equipment, because it's expensive and we understand that. And then we've been able to offer more educational programs, especially this last year through our Ask Me webinar series with incredibly smart and talented guest speakers. So we hope that you check us out on YouTube, and you'll see kind of where to find us at the end of this presentation. So those are just a few things, again, in our care services pillar. I'd actually like to invite our first guest speaker, who is a chapter care manager. Her name is Robin Eller, and she's been with the chapter for several years. She serves the Central Valley, Kern and Inyo counties, part of LA and part of Santa Barbara County. So she's got a big territory, serves a lot of people facing ALS. But really to tell you what she does and maybe share a mission moment with you all, I'd like to invite Robin Eller to say a few words.
Thanks, Cliff. Hi, everybody. I'm glad to be here with you tonight. Like Cliff said, my name is Robin Eller. I've been a regional care manager for the Golden West chapter for the past 7 years. I serve as a partner along with 18 other care managers. And with that, we advocate and assist patients as well as their families and help them navigate through this disease and all of the challenges that come with that, from the moment they're diagnosed and sometimes even before. Our main responsibilities as care managers is to connect with families and get them the resources through the chapter opportunities like Cliff mentioned, government programs, or even other families. Some of the responsibilities is simply just to make sure everyone's receiving the benefits that they're entitled to, getting veterans connected with the PVA, helping people through the disability, Medicare, Social Security. You know, we all know that that's such a challenge in itself. We have a lot of roles as care managers, but I think one of our top purposes is to make sure that our patients are safe and there's safety in the homes. People living with ALS and their families, we can do, during COVID, we've been doing virtual home visits just to make sure that, there's not a rug in the middle of the house, or there's not extension cords, or if they need a threshold ramp. As care managers, we work together with the person affected by the disease and their families, along with their doctors, to ensure that they are getting the best care and given access to one of our multidisciplinary clinics, and make sure they're connected with the doctors and the teams there. As care managers, we work really hard just to relieve the burden of what this disease brings to them and how to navigate through that. And if you haven't joined us in any of our support groups, please feel free to. You can find them on our website anytime. We offer, like Cliff said, we offer a lot of different support groups right now. We have a lot of them for kids and for families, for caregivers, along with the person living with ALS. So there's a lot of resources out there for them through our website. And like Cliff said, I wanted to share a mission moment with you just because I thought it was really fun for this little guy. With our Care for Kids grant, we were able to offer this little kid wanted to take an art class, and it was being hosted in France, but because of Zoom, he could take an online class. It was a little pricey for his parents. So we were able to access that grant through our Care for Kids program, and he had a really good time doing it. So anyway, thank you guys for joining us tonight. And I hope that kind of gives you a little bit of information and highlight a little bit of what we do here.
Thank you so much, Robin. I know I'm personally very lucky to be your partner with community outreach. I admire all the work that all of our care managers do on a daily basis, as they are usually the first person representing the chapter to a newly diagnosed patient and their families every step of the way. So thank you for everything that all of our care managers do. So you've heard about care services. So now let's talk about the next pillar, advocacy. Did you know that each and every one of you attending this program can be an advocate? As an ALS advocate, you can help change laws and policies that affect thousands of people living with ALS and their families. As an advocate, you can get action alerts to write or call your local and federal representatives to help lead the fight against defeating ALS. By simply sharing your story publicly and making needs and priorities known, you are an advocate. So here are some of our advocates' accomplishments at the federal level. Our ALS advocates have successfully increased funding from 20 to 40 million at the Department of Defense ALS Research Program, and from 83 million to 100 million at the National Institutes of Health between fiscal years 2019 and 2020. We've implemented historical regulations at the Department of Veterans Affairs designating ALS as a service-connected disease, ensuring that our veterans with ALS and their survivors have access to VA benefits. Advocates have ended the Social Security disability insurance 5-month waiting period for people living with ALS. And we return to Washington, D.C. every year, in person or virtually, to meet with congressional representatives to share our powerful stories about living with ALS and to advocate for public policy that is important to our community. At the state level, just last year, the chapter joined a broad coalition of dedicated advocates to support the passage of Proposition 14, the Californians for Stem Cell Research, Treatments and Cures Initiative of 2020. The initiative authorized $5.5 billion in state general obligation bonds, with $1.5 billion dedicated to development of treatments for diseases of the brain and central nervous system. And just last week, we're happy to report that the Governor of California approved the state budget, which includes $15 million over the next 5 years for the Golden West chapter to continue the statewide implementation of our proven wraparound model of care. To share more about being an advocate and his reason why is our next speaker, Jared Gill, Secretary of the Board and a good friend of mine who comes out every year to the Monterey Bay Walk to personally barbecue for all the participants. Thank you, and please welcome Jared Gill.
All right. Thank you very much, Tammy. My name is Jared. I've been a board member for about 15 years now, I guess. I've been a volunteer with the association for quite a bit longer than that. I lost my father to ALS back in 2000. And a couple of years after that, we lost my cousin's husband as well to ALS. So it's something that obviously has had a big impact on our family. And I've been working as hard as I can to help reach a world without ALS. And so that's why I do what I do. And as a member of the board, I've had a couple of different positions. I'm currently the secretary, but I've been treasurer as well as a former chair of the advocacy committee. And I found one of the biggest impacts that an individual can have on this disease and future patients is with advocacy. It's such a powerful way to get the message out on what we need as patients or as advocates for patients. I started out going to the National Advocacy Day, which on non-COVID years is typically every May. And it's where we gather up people from all over the country to go talk to Congress about what we need, both for the association and the greater community at large. And so it's a couple of days in Washington, D.C., where we go knocking on doors in Congress. And it surprised me the very first time that I ever went at the impact that we have just going and talking to Congress people or their staff. And a lot of advocacy is building relationships. It's building awareness. And so, for us individuals who show up once a year in DC, it's not about maybe the individual's relationship with a particular congressperson or the staff, but it's their relationship with the disease. And so for us to go out there, share our stories, make it personal to the Congress people out there, to make sure that they know that there's a human face and a human cost with this disease, that makes a huge difference. And we've seen the cumulative effect of that over the years, from just getting started and asking for whatever we could get, a couple $100,000, to getting now millions of dollars every year to fund research, is hugely impactful. And we saw the same thing at the state level in California, where we started a California State Advocacy Committee across all the chapters here in California, going to Sacramento to talk about things that we needed. And it started out very small. It started out with asking for things like the California tax checkoff, where people can donate a portion of their returns to the association. And it grew from there to where, as Tammy mentioned, where now we're getting $3 million a year to fund services like our care managers. So it's incredibly impactful. An individual in that role as an advocate can make such a huge difference. And the biggest pockets around when we're talking about fundraising is the government. And so finding ways for the government to support us is incredibly powerful. And how to become an advocate, it's actually really easy. It's kind of cliche, but call your congressman. I think people, because it's kind of a cliche, people kind of underestimate the power that it has. But that's what they're there for. They're there to listen to us. And if the chapter emails or something like that comes out talking about a specific act or an initiative that we have, it does make a difference for people to email or call, leave a voicemail. All these offices have all that capability to talk about, this is what's important to you as a constituent. And all those voices add up and resonate with these offices to know that, hey, my constituents really care about these specific items. That's going to influence that congressperson to vote in a specific way. And so some of the things that we have going on right now are two different acts at the federal level. We're talking about the Accelerating Access to Critical Therapies and the Promising Pathway Act. And so those have to do with making sure that the FDA is staffed and has the authority they need to be fast and effective with if there's an ALS trial or drug approvals. We have really want to make sure that we have the congressional expansion of telehealth, which we've seen with the pandemic has become such a useful tool. And we want to permanently extend those expansions to ensure that we have access for all our patients going forward there with telehealth. And then we're also focusing on enhancing all aspects of healthcare coverage, from protections for pre-existing conditions to reducing Medicare coverage costs. And then, of course, one thing that we do have to advocate for every year is that research funding I mentioned from the Department of Defense and from the National Institutes of Health. Then through the CDC, we've got a registry as well to collect data there to search for additional treatment pathways as well. So those are things that have to happen on an annual basis in order to stay in the budget every single year. So we do have to be in front of these Congress people every single year. So if you are unable to make it to the National Advocacy Day, either physically, whenever we can open that up with the pandemic subsiding, or virtually, it's pay attention to these emails and communications that come out from the chapter, because those are opportunities to make your voice heard within both the state and federal level to push through these different initiatives that we have. And of course, the chapter is also always willing to listen to ideas so that we can continue to push for better care and what people need going forward. So it's been quite a journey for me in my involvement over the years to see from where we've come and where we are now, and know that we still have a lot of work to do going forward for our patients. And there's a lot of us here to make sure that we make that happen. So thank you very much for all your time.
Thank you, Jared. Absolutely inspirational. As a former community organizer, I definitely believe that the advocacy piece is such a vital part of our mission, and it's really great to hear your personal experience with it and what's on the docket for us. I think there's a lot of things that we are doing and that we can continue to do. So thank you for your part in that and being on our board. And I'm looking forward to hopefully getting some barbecue at the Monterey Walk in future years. So next, our final pillar of our mission is research. And you'll see here, we're relentless in the pursuit of treatments and cures. And now is a really important time in research. There is more investment in therapy development. Our job at the association is to get these ideas to the starting line and then bring in investors to advance those clinical trials. There are more clinical trials happening now than ever before. We fund more than 160 projects in 13 different countries. We go where the science is best. We don't just fund one lab and one idea. We are approached by lots of people with great ideas, and we pick the best of them. And we host the annual California ALS Research Summit, now in its 12th year, which was started by somebody living with ALS, Jim Barber and his wife, Cheryl Barber. They saw the opportunity to bring ALS researchers, clinicians, neurologists, students to share what they're working on and collaborate. And I've been to one of these things, and it is very high level. It's really inspirational to see some of the brightest minds working on this disease, because it is so devastating. It is so hard to know that these really wonderful people, really smart people are working together, not against each other, through something that we put on is really inspirational to me, at least. And we work really closely with our clinical partners, the 27 multidisciplinary clinics. California is a hub for clinical trials, so we have to work closely with those clinics to make sure that those trials are fulfilled, that we can, help those clinics be better, and the clinics can help us be better as well in serving the ALS community. But I'm not a scientist, so I would like to pass it over to our final guest speaker, which is the professor of clinical neurology and the director of the ALS Certified Treatment Center of Excellence at UC San Francisco, Dr. Catherine Lomen-Hoerth, who's going to share a little bit of her personal story and the progress we're making with research.
Thank you so much, Cliff. I appreciate being here and partnering with the Golden West chapter. Without your support, I would not be able to conduct either the research or the clinical mission of our center. So thank you for having me. I grew up in Tucson, Arizona, and knew 3 ALS patients in my neighborhood that had ALS. And that motivated me to, one of the reasons that motivated me to go into medicine and to pursue neurology. The one thing I wanted to highlight about these photos is in just thinking about all the work that the ALS Association does. The patient in this picture is from Hawaii, and he had to actually take a plane flight to come to San Francisco to receive medical care. And now, through the ALS Association's Golden West chapter's expansion to Hawaii, we can now do telemedicine with these patients and provide care virtually, so they don't have to travel. And then this is my husband, Mark, and an ALS walk. I always find the ALS walks to be so inspirational. All of the advocacy that all of the patients and caregivers do along with the ALS Association has been critical to the exciting advances that have happened in recent years. Next slide. So when I came to UCSF as a neurology resident, I was very interested in ALS, as I mentioned, and Dr. Richard Only was following about 30 ALS patients at that time and was willing to take me on as a mentee and allow me to learn from him. And together we grew the ALS Center at UCSF to follow more than 300 patients. And we've conducted over 15 ALS clinical trials to try to get closer to treatments that will help slow this devastating disease. Dr. Only unfortunately developed ALS himself, and in fact, February of 2022 is the 10-year anniversary of his death, and he is deeply missed by all of us at UCSF, and we are forever grateful for the efforts that he made to establish the ALS Center at UCSF and to work towards certification by the ALS Association. Next slide. I realize that this, my section is to talk about research, and very integral to research is multidisciplinary care. What we know from various research studies is that multidisciplinary care, more than any other treatment that we have currently, prolongs both life as well as improves quality of life. So right now, this is the best treatment that we have for this disease. And through the help of the Golden West chapter, we're able to provide access for multidisciplinary care to patients in California, wherever they live, through telemedicine and through the 4 satellite clinics that the Golden West chapter helps us to put on, so that we can really reach all patients in California with ALS and provide them with this multidisciplinary care. So what is multidisciplinary care? Multidisciplinary care includes a variety of specialists to help treat all of the different aspects of the disease. So when a patient's having difficulty speaking and swallowing, they will meet with a speech language pathologist to help with communication and swallowing strategies. They'll meet with a dietitian to help them to avoid weight loss. They'll talk with a social worker to make sure that everything is optimized with their insurance and with the care in their home. They'll meet with a physical therapist and occupational therapist, which helps with their optimize their arm and leg functioning. A respiratory therapist will provide them with vital breathing equipment that they can use either invasively or non-invasively to help support their breathing and provide them with energy and improvement of their symptoms. They will also interface with a nurse, an ALS chapter liaison, oftentimes a mental health professional, and then the ALS neurologist. So this multidisciplinary care is something that is required by all ALS Association certified centers and tremendously improves, like I said, quality as well as quantity of life. In addition, following patients every 3 months and tracking various clinical markers helps us tremendously in terms of our research, because as we test out new therapies, having very careful tracking of a patient's clinical progression is important to correlate with the effectiveness of various treatments. Next slide. And this is our personal team at UCSF, our multidisciplinary team doing the Ice Bucket Challenge. Next slide. So I mentioned about the radical improvements that have happened in the last several years. And for part of that, those improvements is with clinical care. And I want to highlight those, and then I'll get into some of the improvements as far as research. So as far as clinical care, both nutrition and breathing problems can be better treated. We have much better equipment for supporting breathing for patients non-invasively, much lighter equipment. And as far as nutrition, we have much easier ways of supplementing patients' nutrition by allowing feeding tubes can be inserted in a much simpler way with interventional radiology. There are fewer complications. And we have medications now to treat many of the symptoms of the disease: excess saliva, cramping, stiffness, difficulty with sleeping. So we have a lot of good medications now to help with these symptoms. And then equipment advances are helping people to be more independent. Wheelchair advances keep improving. There's various stair lifts that are valuable for patients, various bathroom equipment. So that's helping as well. And then communication is improving. There are many simple software that people can use even with their phone to try to be able to use text to speech and be able to communicate easier, as well as more sophisticated eye gaze systems. And more recently, as you probably read in the New York Times, even surgical approaches to help with communication. And patients are able to stay independent longer. And then telemedicine is definitely here to stay, allowing us to stay connected with our patients much more easily throughout all stages of the disease. Next slide. And so working together with the Golden-West chapter, our goal is to try to expand access to all patients, to try to connect patients very quickly with care, because for most clinical research trials, patients need to be enrolled 18 months to 2 years from their first symptom. And sometimes we don't even see patients until they've had their symptoms for 3 or 4 years. So we need to connect patients sooner to this care, to provide them with access to research, and then working with the Golden-West chapter and advocacy, making sure that insurance will cover these ALS treatments, advocate for more covered care in the home, and then try to reduce the time to diagnosis by improving education and resources to the community for an earlier ALS diagnosis. Next slide. So as far as clinical trials, a lot of patients ask me, why do we need to do clinical trials? There's an exciting therapy that was just found. It worked well in mice. Why can't I just take it? Why do we have to do these trials? And I think the main reason is that sometimes medications that have been very safe in mice, even safe in other diseases, can be toxic in ALS and can cause patients to progress more quickly. And so we always have to have that placebo control, the control where someone is not taking the medication, to compare to know if a drug is causing harm. So that's why it's really critically important. And to determine which patients may benefit from the current treatment, understanding their clinical characteristics and correlating that with the effect of a given treatment. And so I'd like to just run through a few examples of some very exciting clinical trials. One is the ALS HEALEY platform trial. So I mentioned placebo control, and that's something that everyone with ALS hates, because no one wants to have to take a placebo, a sugar pill. And so what the HEALEY platform trial has done is they have created a design where only 20% of patients need to be on a placebo. Typically, it's half the patients need to be on a placebo. And so what the trial also does is it compares multiple drugs to that same placebo group. There's a safety monitoring board that's carefully watching the progress of these various arms of the trial. And as soon as a trial is deemed either toxic or ineffective, it's immediately removed and a new drug is put in its place. And so previously we had to go through separate paperwork every time a new drug was tested. Now with one consolidated process, we can start this trial and have it go on in perpetuity, continually cycling in new drugs, continually allowing patients to have access to these treatments. And so this trial is ongoing at CPMC, and at UCSF, we expect to be onboarded in September. So there will be opportunities for patients to have access to 2 sites in San Francisco to be able to be a part of this important trial testing a variety of exciting new therapies. And then one thing that happened in 2017 is we had a new FDA approved drug for ALS called Radicava. It's an intravenous medication. And there's a study, the company is doing a study looking at various biomarkers to determine which patients may benefit most from this treatment. And so if you wanted to be in this trial, it's called Refine. You can take Radicava, 100% of patients can take Radicava, no one's on a placebo, and then a nurse will come into your home monthly and check things like breathing measurements, strength testing, checking your weight, and seeing the effect of the drug on your particular disease course. So we're very excited about that study as well. And then lastly, there are many trials that are being tested and have a lot of promise as far as the genetic form of ALS, which occurs about 10% of the time. And you would know if it was in your family because one of your parents would need to have had either ALS or frontotemporal dementia. And these particular treatments are very targeted precision medicine treatments to be able to attack the gene that is affected by the disease and hopefully lead to significant slowing or maybe even halting of progression. So those are the particular trials that I'm most excited about, but there are many more things in the pipeline as well. And I think that's the last slide, but maybe just if you want to go to the next slide just to make sure.
Yeah.
Right. So just lastly, everything we all do together, as you've heard tonight, is supporting ALS patients and is advancing our ability to provide more effective treatment and ultimately a cure to this population. So thank you very much.
Wonderful. Thank you, Dr. Lomen-Hoerth. Always come away from hearing you speak and others like you talking about ALS with new information about how we're advancing that research arm and new ways to advance that. So thank you for being here and thank you for explaining that. And we'll, of course, a reminder for everybody, if you do have questions, please chat them to me directly, and then I'm sorting those and I'll be sure to ask those questions aloud. So if you do have questions for Dr. Lomen-Hoerth, feel free to shoot those over to me. And like Kathy said, or Dr. Lomen-Hoerth said, it really does support everything that we do here. And I hope that hearing these three pillars, you're making the connection that the people with ALS and their loved ones are first and foremost with what we do at the Golden West chapter. And that's how we do what we do. It's how we raise the money that we use to fund our mission. It's how we are the largest philanthropic contributor to research. It's how we have a strong presence in Washington, D.C. and in California. It's how California is one of the biggest hubs for clinical trials. So it really all ties together. And I really, again, hope that you come away from this part of our presentation understanding that. And so next, I want to invite Tammy back to talk about how we actually receive our funding and how we spend it a little bit. So back to Tammy.
Awesome. Thank you, Cliff. And thank you again so much, Dr. Lomen-Hoerth, for being here this evening. I know she was literally wrapping up a clinic right before she joined us. And I have had the privilege of working with Dr. Lomen-Hoerth before at one of her clinics. And it's so evident how much she cares deeply about all of our patients and their families. And we're definitely very grateful to have her. So, okay, so we're going to go to the next slide, and we're going to talk about where does our revenue come from. So as you can see on the slide, 62% of our revenue comes from individuals, foundations, and corporations. Individuals are the largest source of gifts to the chapter. Corporations are very generous partners, many of whom renew their commitments yearly, but there's always room for new corporations, so let us know if you know about any of those to join the fight. Estate and plan giving is another revenue resource, in which we have training for individuals wishing to know more about estate and plan giving on our website at alsagoldenwest.org. Other sources in this category include, but are not limited to, corporate matching. A lot of corporate do matching gifts for people who donate to their charity of their choice. Community of Hope, tribute pages, grants, major gifts, and several events, which we're going to talk about those in a minute. 33% of our revenue comes from public grants, including California and Hawaii, and government grants like the ones you heard about during our advocacy presentation. As you can see in the summary of chapter events expenses, 82 cents of every dollar goes back into our programs to drive our vision of a world without ALS. And it's that figure, among other factors, that has helped the chapter to achieve the highest rating by Charity Navigator for the 8th consecutive year for our commitment to sound physical management, accountability, and transparency. All right, so now the fun stuff. We get to talk about our events. Take a look at this calendar and where you may want to get involved. For example, my favorite, the Walk to Defeat ALS, is being held on October 23rd. It's an interactive virtual event. It's said to be the largest annual gathering of the ALS community and the largest support group of the year. 11 walk communities in 31 counties in California and including the state of Hawaii will be joining virtually on one day for one walk. There'll be a very entertaining opening ceremony with special guests. You will join hundreds of other teams, over 800 participants, to walk your way to defeat ALS. You can even join a care manager's team. I'm sure he or she would be happy to have you. Or you can just start your team of your own, be a single participant, whichever you choose. You are welcome to visit our website, walktober.org. That's walk-tober.org to learn more. And also our website. Our website at alsogoldenwest.org is just full of all the information, more of the information that you've learned tonight, how to be an advocate, how to contact us about those support groups. So we really want to invite you to check out our website. So I talked about the walk. Did I tell you about the walk? Right, October 23rd. Okay, everybody knows about the walk. Thank you again for everybody for being here tonight. We really appreciate you spending your time with us. And there's another really big event that we love. Cliff, tell us all about it.
Yeah, so, well, first, of course, the walk is incredible. I love that it's on one day. I think everybody, I just can't wait to see everybody out there all over the state and Hawaii doing something on the same day. I think that'll be a really great way to raise awareness and funds for what we do. So part of my portfolio is the Napa Valley Ride to Defeat ALS. It's actually the largest single fundraiser for ALS in the country. We've raised collectively over $9.5 million in the last 16 years. We want to raise over $1 million this year, so we hope you can join us. It's going to be in person, hybrid. You can also participate virtually on September 18th. For riders only, we're not going to have a walk portion. So hope you can join us there. We have a number of other Team Challenge ALS events. Again, like Tammy said, go to alsogoldenwest.org to find out more. And that's pretty much our presentation. We want to say thank you to all of you. You power what we do, again, at the chapter. You make all of this possible. You are advancing our mission, getting us closer to our vision of a world without ALS. There's a lot of work to do, and we know that. And we know that the more we can raise, the more we can do. And so we hope that you'll support us with that. We also want to say thank you to our community partners, Mitsubishi Tanabe Pharma America, and Cytokinetics. They've been supporting the chapter in multiple different ways, events and programs, and nationally. So want to say a big thank you to them. We also have one more survey, so we're going to launch that now. And we just want to know how you want to stay involved with us. And that might be attending or participating in an event, learning more about clinical trials, taking advantage of chapter services, become an advocate, you want to share your story. So please take a moment. We're going to give everybody about a minute to fill this out. The sooner you check that box, the sooner we'll be able to share the results and get to the Q&A. So please take a moment to do that. And just as a friendly reminder, while you're doing that, if you do have questions, send them over my way. I am seeing a lot of those coming through, so I'm collecting that as we speak, and we'll be getting to that section in just a moment. All right, we're about halfway through answers. If you haven't had a chance to answer, we'll give you another 10 seconds or so to check your boxes. All right, I think we can end the polling there and share the results. Looks pretty even. Although I think we need to do some work in getting some folks to be an advocate, Jared. But yeah, we're again going to be sharing all this information. We'll be sharing the recording after probably tomorrow. If you would like to share that with your network, there's lots of ways to get involved. So we'll be sure to share that with everybody who's attending tonight. So then we can stop sharing that. If you'd like to stay in touch with us, follow us, please, on all social media channels you see in front of you, at Also Golden West. Almost all of these recorded videos, webinars, learning educational programs are on our YouTube channel. Hashtag us at Challenge ALS, Never Give Up, our ALS community. And ultimately, it's you sharing your story with your network that helps us do what we do, raises awareness, and funds for a world without ALS. So again, thank you. We're going to get right into the Q&A section here. So I think we can probably stop sharing our screen and then we'll get to that. I'm just going to close a couple things here. All right. So maybe this is a question for Dr. Lomen-Hoerth. Are there trials, this is from Dina Reed, are there trials going on for PALS, people living with ALS, who've been living with the disease for more than 5 years? If we can unmute, here we go. There you go.
I'm unmuted. It's a great question. And currently there are lots of trials that one can participate in when they've had ALS for a longer period of time, as long as they are not specifically treatment trials. So there are many interesting natural history studies trying to understand what makes one person be able to be doing really well at 5 years and someone else doesn't have 5 years. And so trying to understand what's different about patients who do really well with the disease is very valuable to research. And so being able to participate in those kinds of natural history studies, biomarker studies, things like that is very valuable. But as far as specifically testing treatments, those are restricted to very early diagnoses. But keep in mind that with all of the advocacy work that the ALS Association locally and nationally have done, we have a much faster track to approval. So once I just think about how fast Radicava was approved, the data was presented to the FDA in May and the drug was in patients' arms in August. So I think that if something is effective, it will get to all patients with ALS very quickly.
Thank you. This question is, I guess, for Jared. Are there available talking points or a place for people to find talking points for our advocacy efforts and public policy priorities that people can have?
Yeah, I think there are a number of emails that have gone out, and I believe we've got advocacy on the ALS Association's website as well. That is probably the best source for the federal talking points. And then there are periodic communications that come out by email or social media as well for specific things that we have going on at the state level too.
Thank you. And another question to you, Jared. If you could tell us one of your favorite memories or accomplishments as an advocate.
I think working with Jim Barber in California and getting the California State Advocacy Committee going is definitely my favorite accomplishment, I would say. You know, there wasn't really anything going on at the state level at that time. The chapter started doing some work with a lobbyist early on. That was funded by Dean and Kathleen Rasmussen, longtime donors to the chapter, to help us get that going. And the national advocacy effort had been ongoing at that point. So just getting something going in California and starting from the ground floor and building the relationships to then get us to the point where today we've had some pretty amazing successes. It's that's probably been the most rewarding. And you know, Jim Barber was an amazing advocate and a mentor of mine as well. So it was good times.
Thank you. This question is back to Dr. Lomen-Hoerth. A few questions from Jennifer Powers. Thanks for throwing a lot of those in there. One was the kind of dementia you talked about, referred to with genetic form of ALS. And then another one is referring to Dr. Olney. Did he already have ALS before he went into research? And if not, then how did that happen? Was the question.
Sure, those are great questions. So C9orf72 is the gene that is the most common gene to cause both ALS and a condition called frontotemporal dementia. And so these diseases are connected, and therefore a parent in the familial cases might have dementia only, or ALS only, or ALS and dementia. And that's particular to that particular gene mutation. There are other gene mutations in familial ALS that do not cause dementia at all. And patients can also have frontotemporal dementia without a genetic cause, just like there are people that can have ALS without a genetic cause. But the pathology is the same, and the many of the genes causing these diseases are the same. So there is that connection. The second question around Dr. Olney, he did not have ALS when he became a neurologist, and it was just one of those fluky things that that occurred. And so yeah, no, didn't run in his family or anything like that. So very, very unfortunate.
Thank you, Dr. Lomen-Hoerth. This question is for Robin. Can you talk about how you work with the clinics and help with equipment loans?
Yeah. So when Dr. Lomen-Hoerth or Cedars has clinics, right now we're doing them virtually. So we sit in with them and we meet with the disciplinary teams. So if they're ordering respiratory equipment, or if OT, occupational therapy, is ordering any kind of equipment, they need some assistance with getting that out of the loan program until the insurance kicks in and gets that for them, or if they don't have the coverage for that. So then we work to get that through our loan pool or through a grant, so they're able to access their benefits faster than if they needed to get authorization for that. And as far as the other things with clinics, so when we meet a family that has recently been diagnosed and they haven't been connected with an ALS Center of Excellence, we do recommend, obviously, Cedars-Sinai, UCSF, the Centers of Excellence that we support, and get them connected there so they can get the best care that is accessible to them.
Thank you, Robin. Another question for Dr. Lomen-Hoerth. There might be a few. So this is a question that we get every once in a while, and the question is, in the 90 years since Lou Gehrig was diagnosed, there still aren't really effective treatments. How do you explain that?
Yeah, another great question. So this is true of all of our degenerative diseases: Alzheimer's disease, Parkinson's disease, ALS. We don't have wonderful treatments. And that's because we don't understand the science as to what causes these diseases. And we are getting closer to that, but these are just very hard diseases to understand. They haven't left a lot of patterns behind that we can look at and can understand what causes it. But also keep in mind that even for that there really aren't a lot of diseases in medicine, if you think about it, that we can actually cure. We can't cure diabetes, we can manage it. We can't cure heart disease, we can control it. We can certainly help people live longer with other diseases, and we want to get to that point certainly with ALS. But in reality, unless it's like an infection that can be treated with an antibiotic and then disappear, we don't have as many cures in medicine as we would like.
Thank you for that. And then I guess one more. I know we're a little at time, but we started at 5:05. So if you do again have questions, feel free to shoot them over to me. For Dr. Lomen-Hoerth, we have heard, or this person has heard a lot about AMX 0035. Can you tell us a little bit more about what that is? Do you know about it?
Sure, it's a promising treatment for ALS. It's a combination of TUDCA, TUDCA, which is available from Amazon. You can purchase it yourself and take the doses used in the study, 1,000 milligrams twice a day. And in this study, they combined it with something called sodium phenylbutyrate, which is by prescription, so that one's not as easily available. But in a phase 2 trial, it did look quite effective, and the FDA would like the company to do a larger phase 3 study. There is also a large phase 3 study of TUDCA alone being conducted in Europe, and there was a paper showing promise of TUDCA alone. So I think what's exciting is that a lot of therapies that are being tested in clinical trials, people don't have access to. But in this case, people can access TUDCA, and it's very well tolerated and easily available.
And then also to you, I think this might be the last one. What other treatments are looking promising, which is a big question. Are there any stem cell treatments that you see that are promising as well?
Yeah, I think ultimately stem cell treatments will be promising, but I think for right now, what we currently have available, the large brainstorm stem cell trial that everyone was very excited about, ended up not being effective, unfortunately, but in a smaller subset of people who are rapidly progressing, it looked like it may have some effect. So I think we just have to be able to get the cells to the right place, keep them alive long enough to be able to produce those growth factors that help the nerves stay healthy. So we will get there someday, but it's not here today. And I definitely strongly advise about getting any stem cell therapies off-label in other countries or in parts of the US, because I've seen pretty serious consequences when people have done that.
Yeah. Okay. Well, thank you, Dr. Lomen-Hoerth. Thank you, Robin and Jared, and our guest speakers. Thank you all for being here and taking the time to listen more about what we do at the chapter, how we're defeating ALS together. It's the only way we're going to do it. If you would like to learn more about clinical trials, how to become an advocate, chapter services, or if you'd like to make a donation, again, please go to alsagoldenwest.org, also goldenwest.org, and you can join us at any of our events this fall. And we hope to see you again at another webinar or an event in the future. Thank you all again for being here, and have a wonderful evening.
Thank you, everyone.